All right, let's jump right into this explainer. Today, we're unpacking a massive shift in medicine regarding a condition I'm sure you or someone you know has heard of. We're talking about a fundamental change in how the global medical community understands a very common health issue, moving away from a deeply limiting label and adopting a comprehensive, frankly, life-saving new one.
170 million. Just let that sink in for a second. That is the staggering number of people worldwide affected by a condition that the medical community has fundamentally mislabeled for decades. We are talking about a massive portion of the global population trying to navigate their daily health under a banner that simply doesn't tell the whole story.
Which leads us to a really profound question. What if we've literally been naming it wrong all this time? Well, that's exactly the question global medical experts recently had to ask themselves. Imagine having a condition that impacts your entire body, but the name on your medical chart points to one single organ.
Section 1. A misunderstood syndrome.
For decades now, this condition has been known as PCOS, or Polycystic Ovary Syndrome. And the problem is, that name incorrectly framed it as primarily a gynecological disorder. I mean, when you hear the word ovary sitting right there in the middle of the diagnosis, the natural assumption from patients, and honestly, even a lot of medical professionals, has been to treat it strictly as a reproductive issue.
But here is the truly wild reality about this. Despite the name, ovarian cysts aren't even present in a huge number of patients. The very thing this syndrome is named after is frequently missing. So for years, this misnomer has completely overshadowed the condition's broader health implications.
And this narrow, inaccurate framing, it had severe real-world consequences. We're talking fragmented care and missed opportunities for early intervention in other really critical areas of health. Because it was viewed through this purely reproductive lens, there was immense stigma around fertility, and people faced majorly delayed diagnoses. But perhaps most alarmingly, it led to missed interventions for serious metabolic and cardiovascular risks, things like insulin resistance and heart disease. Patients were essentially left playing whack-a-mole with isolated symptoms instead of treating the root, systemic causes.
Dr. Melanie Cree, a pediatric endocrinologist at CU Anschutz who helped lead this global effort, really hit the nail on the head. She noted that for too long, the narrow definition of PCOS has overlooked its metabolic and hormonal complexity, leaving many patients undiagnosed or misunderstood. It perfectly captures the frustration of people who suffered, simply because their complex symptoms didn't fit neatly into a strictly gynecological box.
Section 2. The name change.
So how did this fix come about? Well, a massive global consensus study published in the Lancet in May 2026 officially triggered this change. And this was driven by worldwide experts and patients alike. It wasn't just a handful of doctors in a room. It was a huge, collaborative, international effort to rewrite medical history and finally correct a decades-old wrong.
So we are officially moving from the limiting PCOS to the comprehensive new name PMOS. Polycystic Ovary Syndrome becomes Polyendocrine Metabolic Ovarian Syndrome. I know, it's a bit of a mouthful at first, but trust me, every single word in that new name absolutely earns its place on the medical chart.
Section 3. What is PMOS? Let's actually break down that new terminology. First up, polyendocrine. This word was added to finally reflect the true hormonal complexity of the condition, which extends way beyond just the reproductive organs. It acknowledges that this involves multiple hormone-producing glands. It's a system-wide hormonal imbalance, not just a localized one.
Next, we have metabolic, and this addition is absolutely vital. Metabolic is included to acknowledge the serious cardiovascular and energy processing risks, like type 2 diabetes, that were dangerously ignored under the old name. We are talking about long-term cardiometabolic effects that require proactive management for a patient's overall well-being and survival. So by breaking it down, we can clearly see that PMLS is a holistic, multi-system condition. It affects 5 major aspects of a person's health: endocrine, metabolic, reproductive, dermatological, and psychological. That is a deeply complex web, and it requires a unified, comprehensive treatment approach from medical providers.
Section 4. Why language matters.
As Dr. Cree so eloquently points out, language matters in medicine. This change helps shift the conversation toward overall health rather than just a single aspect of the condition. Shifting away from fertility-focused language immediately begins to strip away the stigma attached to the diagnosis.
It essentially tells the patient, hey, we see your whole health, not just your reproductive capacity. Because at the end of the day, words dictate treatment and treatment dictates outcomes.
Now, to make sure this isn't just some cosmetic rebrand, the medical community is currently taking 3 massive steps to implement PMOs globally. Step 1, they're updating clinical guidelines so doctors know exactly how to treat it systemically. Step 2, they're revising medical education so the next generation of physicians learns this right from day 1. And step 3, they're aligning international disease classifications, which means health systems all over the world will finally code and recognize this condition accurately.
Ultimately, this renaming ushers in a whole new era of awareness, and it brings tangible, life-changing benefits to millions of people. The PMOS impact promotes earlier diagnosis, it supports holistic, patient-centered care, it actively reduces that fertility stigma we talked about, and crucially, it expands systemic research into those vital metabolic impacts.
And it is incredibly empowering to know that this milestone was built directly on the advocacy and lived experiences of the patients themselves. Like Dr. Cree noted, what makes this effort especially powerful is that it reflects the voices of thousands of patients and clinicians from around the world. It wasn't a top-down mandate, it was a grassroots demand for accurate representation that grew into a massive global consensus.
Accurately naming a condition is really just the foundation. So, as we wrap up our explainer today and look to the future, we have to ask, how will treating PMOS as a full-body condition redefine the future of women's health? It's a question that opens the door to better care, better research, and a profoundly better quality of life. Definitely keep that question in mind as this medical shift continues to unfold globally.